Let's talk about something incredibly common, yet incredibly silenced: pain during sex. If you are in your 30s or 40s and intimacy has become a source of anxiety and pain instead of pleasure, you may have been told it's just stress or that it's all in your head. But what if I told you that the main cause of this pain is a real, physical condition that is frequently missed or misdiagnosed, even by well-meaning doctors? Today, we are unmasking the hidden culprit that could be sabotaging your intimate life. Pain during intercourse, known medically as dyspareunia, is not a life sentence. It is not something you should ever have to just live with or accept as a normal part of being a woman. It is a valid, important medical symptom, and it deserves a real diagnosis and a real, effective solution. While there can be a multitude of causes ranging from temporary infections and skin conditions to lubrication issues, today we are focusing on two of the most common, deeply impactful, yet least understood silent conditions that affect millions of women in their prime reproductive years: endometriosis and vaginismus. Understanding these two conditions is the first step for countless women to finally get the answers and the relief they have been searching for, sometimes for decades. Let's begin with the master of disguise, the condition that is often invisible on standard tests and ultrasounds: endometriosis. To understand this complex disease, we first need to understand the endometrium. This is the specialized tissue that lines the inside of your uterus. In a normal, healthy menstrual cycle, this tissue builds up each month in preparation for a potential pregnancy. If no pregnancy occurs, it is shed during your period. This is a perfectly contained and normal process. In endometriosis, however, tissue that is similar to the endometrium begins to grow outside of the uterus, in places it absolutely does not belong. These rogue tissue growths, called implants or lesions, can appear on the ovaries, the fallopian tubes, the outer wall of the uterus, the ligaments that support the uterus, and even on the bowel and bladder. The critical problem is that this misplaced tissue still behaves as if it were inside the uterus. It responds to your monthly hormonal cycle, it thickens, it breaks down, and it bleeds. But unlike the menstrual blood from your period, which has a clear exit path from the body, this internal bleeding has nowhere to go. It becomes trapped within your pelvic cavity. This trapped blood is highly inflammatory. It irritates the surrounding nerves and organs, causing a chronic, smoldering fire of inflammation inside your pelvis. Over time, this chronic inflammation leads to the formation of scar tissue, known as adhesions. These adhesions are like webs of tough, fibrous glue that can stick your organs together, causing them to become tethered and immobile. This entire process, the bleeding, the inflammation, and the scarring, is what generates the debilitating pain associated with the condition. One of the most specific and agonizing symptoms of endometriosis is deep pain during or after intercourse. This is not a superficial entry-level pain. This is a deep internal aching or sharp stabbing sensation that can occur with deep penetration. This happens because the physical movement and pressure of intercourse can stretch, pull, or directly impact these sensitive, inflamed endometrial implants, particularly those located in the area behind the cervix, known as the posterior cul-de-sac. The pain can be so severe that it forces women to avoid intimacy altogether, creating a profound strain on their relationships and self-esteem. Beyond painful sex, there are other classic signs of endometriosis that are often dismissed for years as just bad periods. These include excruciatingly painful menstrual cramps that don't improve with standard painkillers like ibuprofen, chronic pelvic pain that persists even when you are not menstruating, pain with bowel movements or urination, especially during your period, and for many, significant difficulty in getting pregnant, as the inflammation and scarring can damage the ovaries and fallopian tubes. The immense tragedy of endometriosis is the diagnostic delay. The average woman suffers for 7 to 10 years before receiving a proper diagnosis. Her pain is normalized, minimized, and often dismissed as psychological. But your pain is real, and it has a name.
Now let's discuss the second major culprit, which can exist on its own or, very often, as a direct consequence of endometriosis. Vaginismus. If endometriosis is the structural fire, vaginismus is the neurological alarm system that has gone haywire. Vaginismus is the involuntary, reflexive, and often painful contraction of the pelvic floor muscles that surround the vaginal opening. This is not a conscious choice. It is a subconscious protective reflex. Just like flinching when you think you're about to be hit, or your eyelid automatically shutting when an object comes close to your eye. The muscles are clenching in anticipation of pain. This involuntary spasm can make any kind of vaginal penetration, from intercourse to inserting a tampon to a gynecological exam, incredibly painful or completely impossible. What triggers this powerful reflex? It is a learned response, a cycle that often begins with a real physical source of pain. For example, a woman might have undiagnosed endometriosis that causes deep pain during sex. Her brain, being the brilliant protective organ that it is, learns to associate penetration with a threat. Over time, her pelvic floor muscles, in an attempt to protect her from this anticipated pain, learn to automatically clench and spasm before anything even happens. The mere thought or attempt of penetration can trigger the response. The body is trying to build a muscular wall to keep the pain out. This is why vaginismus is so often found in women with endometriosis, vulvodynia, or a history of recurrent infections. It can also be triggered by purely psychological factors such as past trauma, a strict upbringing, or a deep-seated fear or anxiety related to intimacy. The most crucial thing to understand is that this is a real physical response that the woman has very little conscious control over. Telling her to just relax is not only unhelpful, it can be deeply invalidating. It is like telling someone not to flinch when you pretend to punch them. The body's protective reflex is faster and more powerful than conscious thought. Breaking this cycle requires more than just willpower. It requires a specific strategy to retrain the brain-body connection. So, what is the path to healing? The solution must be multi-layered, addressing both the physical fire and the neurological alarm system. For endometriosis, a definitive diagnosis is often made through a minimally invasive surgical procedure called a laparoscopy, which allows the surgeon to see and remove the endometrial implants. Other treatments can include hormonal therapies like birth control pills to suppress the menstrual cycle and prevent the growth of new lesions, as well as effective pain management strategies. For vaginismus, the gold standard life-changing treatment is pelvic floor physical therapy. This is not about doing Kegels. In fact, for many women with vaginismus, Kegels can make the problem worse by further tightening already tense muscles. A specialized pelvic floor therapist is a detective for your muscles. They will teach you how to consciously relax and release the tension in your pelvic floor. This is often done through a combination of techniques: diaphragmatic breathing to calm the nervous system, gentle manual therapy to release trigger points, and the use of vaginal dilators. Dilators are a set of smooth, tube-shaped medical devices of increasing size. The woman learns to insert them herself in the privacy of her own home, starting with the smallest size. This process is done slowly, at her own pace, and it allows her to gently and progressively teach her muscles and her brain that insertion can happen without pain. It is a powerful way to desensitize the fear response and reclaim control over her own body. If you are experiencing pain during sex, please hear me when I say this. It is not normal. You are not alone, and it is not your fault. The first and most important step on your journey to recovery is to find a compassionate and knowledgeable healthcare provider, a gynecologist who specializes in pelvic pain, who will listen to your story, take your pain seriously, and guide you toward the right diagnosis and treatment. It can be a long and challenging road, but a diagnosis is the first step to getting your life back. You have the right to an intimate life that is filled with pleasure, not pain. Breaking the silence around these incredibly common but rarely discussed conditions is the first step to healing for millions. If this video has given you the clarity or the courage to seek help for yourself or a loved one, please subscribe to Dr. Maskola. We are dedicated to providing the trusted, in-depth information you need to become the CEO of your own health. Let's learn, heal, and thrive together.